right, guys. So we're here. We're going to be talking about how to do hair restoration. I'm here with my lovely wife, Jennifer Sewell. And we're going to start by doing a quick exam of her hair and kind of talking about her hair health initially. Maybe you could tell everyone kind of what you've been dealing with, kind of the history of everything.
Sure. So my whole life I've had like fine, thin hair. And it seemed like after pregnancy, it was even more thinning. So I had great, hair during pregnancy, maybe a month or two after postpartum. And then after that, maybe, I don't know, like 5 years after my child's birth, it was good. I got hair extensions, and that kind of started like a 15-year cycle of hair extensions in, hair extensions out. For those of you who've had hair extensions, they're a ton of maintenance. They cost a lot of money, and kind of like your life revolves around getting your hair maintained. So I've taken my hair extensions out, and I want to try to work on my hair health. So I want to see what happens with my hair if I leave my extensions out, and try the Keravive, PRP, any other regenerative factors we can try. So feel free to follow along and see how it goes.
All right. So first thing I'm going to do is I'm going to take a quick look using this camera here. And what this does is this gives a magnifying of about 50x to 200x. And we can actually look at the hair follicles. I'm going to try to show you here on this display what they look like. So we'll kind of ask you to hold this for the camera, and we'll kind of take a look real quick here. So when we look at the scalp, what we're seeing is that we do see normal hair, but we also want to take a look closer and see those follicles. And so now you can see with the camera, you can actually see the hair follicles themselves in detail. And we can even zoom in if we need to and actually look at the hair follicles. And what we're looking for any signs of scarring, any signs of inflammatory illness that would be causing the hair to come out. And we're not really seeing that at all. What we're seeing is just kind of healthy hair. You can kind of see here, you can see some of the smaller hair follicles, but notice their hair is in the follicle. The follicles are looking pretty good. We're going to kind of zoom over here, take a look. So I'm not seeing any signs of, what we considered cicatricurial hair loss or alopecia. I see that there's hair, some smaller hair, maybe some thinning hair, but hairs are all in the follicles. Follicles are all in place. This is a really great sign because it means that treatment in this area is going to be successful. We're going to take a look at the area where the hair extensions were placed to kind of see, we might see some traction alopecia there is kind of what we'd be expecting.
And typically like the first row would have been there.
So we look here, we see hair, it's doing pretty good. And then we do see just some areas where there's just hair follicles, but the hair is kind of small or maybe even thin. But we do see follicles in every single area, which is a great sign. So, and you can see here where there's, basically like this one right here, you can see there's definitely a hair follicle. It has a very small hair. And this is probably secondary to the hair, the traction alopecia causing that. And now the hair is starting to regrow already. So that's a great sign. Our goal would be to make that hair thicker and longer, which is what Jennifer's kind of looking for. All right. Next thing we'll do is we're going to start first off by cleansing the scalp using a machine known as a hydrofacial to basically stimulate the scalp through suction and get the scalp clean prior to our treatment. So we'll be doing that next.
And just kind of a little plug here for Hydrofacial. We're not sponsored or endorsed for them, but we do love the Hydrofacial. So if you are a provider and you're looking for a facial machine, we really love ours. We love the fact it can do facials and it can do hair restoration. It's kind of multiple modalities. I know a lot of people that are medical kind of say, well, why would I buy a Hydrofacial? Anyone can buy a Hydrofacial, but you actually have extra benefits if you are a medical provider. You can do deeper peels, deeper strength peels than what, anyone else can do. And you also get specialized boosters from Zeo, Elastin. There's a couple more brands they have that's only reserved for medical providers. So it does make you stand out, but we love it just for the multiple modalities, the different facial modalities, but also now hair restoration as well.
So hopefully you guys can see okay here. Basically, this is the Hydrofacial. It has a tip here, and you can probably hear the suction sounds. And you see here, there's a tip, and that tip basically is kind of like a vortex-looking tip. It basically sucks in any kind of impurities and stimulates the scalp prior to our treatment.
Now, just be curious for any women that are over the age of 40, like how your hair is now versus when you were in your 30s. It seems like it does, when our hormones change, it gets thinner. We don't maybe have the thickness we once did, but also even length. Like it seems like it doesn't grow to the length it once did.
So this has a serum in it that basically will help cleanse the scalp. So what I'm doing is I'm basically going over the center 2/3 of the scalp and basically cleaning it, stimulating it, and using this serum basically to do that. As soon as it gets into the large hair part, like the suction just goes down a lot. All right. Well, we have some of the scalp cleaned there. Now we're going to draw some blood here and get ready for the PRP. Sorry, is that okay? Mm-hmm. Okay, nice and tight. And I'm making some fists there. Little pinch here. Doing okay?
Mm-hmm. Is it going to feel good?
Oh, great. Yeah, almost done. So we're going to get a few vials of blood here. A total of, looks like 6 blue tops. And these blue tops can be purchased through Henry Schein. And if you're part of the AIC, it's already part of your Diamond Buyer Club membership. You can get discounts on these guys. That we don't have to pay retail prices for these, you know. And also sometimes they can be hard to find. They can be out of supply. So, okay. Okay, ready? 1, 2, 3. I like to hold just a little bit of pressure. It decreases bruising. But as you can see, pretty much just get a venipuncture, grab yourself some blue top vials, and then next we'll go and we'll actually spin it in the centrifuge. And I'm just going to make a little bandage here. And then I personally use the Tegaderm as kind of almost like a pressure dressing, if you will, to hold on. This is a 4x4, it's been folded up. That way it keeps it nice and tight, and it looks good, nice and clean. And there's plenty of gauze to absorb any kind of excess bleeding. All right, guys, so we're back. We're going to be doing the PRP injections here. I'm trying to get the camera set up. We're able to get quite a good amount of PRP from Jennifer's blood there. And what I have here is I have just a 5cc syringe with a 27 gauge 1/2-inch needle I will be using. And we're going to try to focus on, as we look at her hair, she has very beautiful hair, but there's some areas that may have been had traction from the hair extensions, or just perhaps hair thinning. And what we can do is we can supplement these areas here along the scalp. And probably, here is an area where we have some thinning of the hair we can supplement as well. So what we normally do for the scalp is very vascular. So we don't necessarily need to prep it, but I usually prep it with alcohol before each injection. You don't have to do that. There are people who have successfully done this for years without any issues in terms of infection, etc., without prep, just because the scalp is that vascular. All right, so you ready?
I'm ready.
Ready she'll ever be? Okay, so let's just start here and see if we can knock out some of these injections here. So I'm just going to clean the scalp again. We did once already with our machine, but this is make sure no bacteria are there. That being said, if you didn't do that, I don't think it would be the end of the world either. So with my 27 gauge 1/2-inch needle, you can see it has a bevel. I usually use bevel up, and we're going to move. And whenever you do an injection, the area that is the most sensitive is the area that is usually the dermis. And so the dermis has most of the pain receptors, et cetera. So you want to move through that fairly quickly. And so I'll show you kind of how I do it. And Jennifer kind of be the guide as to how it feels there. So a little pinch here. 1, 2, 3 pinch. Sorry about that. How was that?
Not bad at all.
Perfect. Mm-hmm. Okay. And so we're just going to do a series of these, just kind of from here to towards the back of the scalp, kind of where the hair extensions were. So I'm using one hand to support, one hand for the injection. So notice I bevel up here. 1, 2, 3. See, kind of like a dart in, followed by the injection, and then out. So if you notice the in is, if you can kind of go almost like a dart in, you'll find it to be much less painful. If you go really slow through the skin, it's much, much more painful for the patient. So you can see I already have a little string of injections going here. I'm just going to go all the way back to the back of the scalp. 1, 2, 3. Sorry about that. 1, 2, 3. All right, doing okay? And then let's see what we can do here. We get this cleaned up. But that's basically it. It's essentially doing that. And remember that each injection will yield you roughly about a dime size of extension. So whenever you do an injection, realize that about a dime size, the growth factors will extend to. So you can imagine, if you can, each little injection leading to a dime of fulfillment there. and we'll just kind of continue from there. It's wise to always change your needle because the needle will unfortunately get dull pretty quickly, particularly when you're working in the scalp. So I'm switching needles. And then for this part, if I can trouble you to look that way, I'm going to try to get to the back of the scalp here. Sometimes on the back of the scalp, it can be a little bit more sensitive. The angle that you want to approach is that if you can imagine there's a sphere, the angle you want to approach is almost at kind of a, maybe like a 15-degree angle to the surface. Let me see if I can demonstrate that here. Once again, bevel up. 1, 2, 3, pinch. Sorry about that. Doing okay?
Mm-hmm.
And we're getting about 0.1 cc's or so in each injection. All right. Then we'll go down and we'll probably do this area here because we notice that we look with even just our eye, we can see that some of the hair that's coming from here is a little thinner than some of the hair on the top. This will likely give more of a thicker hair appearance. We'll probably start from back to front. Just let me know how it's feeling for you.
I think after about 5 pokes, you'll change the needle.
Okay.
Like the first year, I didn't feel it all, and about 5, and then it was 6.
They get dull fast, right? And some of that will depend also on the patient too. So, and again, bevel up here. I just prime where the needle is. How was that one?
Yeah, I didn't really feel it.
Yeah, so it is the needle.
Mm-hmm.
So let me just grab a whole bunch of needles real quick here, and we'll kind of resume. Got a little bit of bleeding here, so I'm going to put some pressure. All right, so I'm just going to update the needle, get a new needle, and we'll get started again. All right, so we got bevel up. We're going to prime it a little bit. Just finish these guys. Doing okay?
Mm-hmm.
The last few were a little more intense.
Yeah.
I put a little more volume in.
Okay,
so
in between 3 and 5 as it gets intense.
All right, how's that for you?
That's good.
Feeling better?
Mm-hmm.
So we'll work on the other side now, if that's okay.
Mm-hmm.
As always, again, bevel up. Got a 27 gauge half-inch needle. Primed it, as you can see there. It was doing okay.
Mm-hmm.
And that was
5.
5, exactly. We'll probably go through quite a few needles today. All right, so we got those done. If you don't mind to face this way.
Face.
Yeah, sorry. I didn't use my words. I used my hands. Can't see it. All right, so let's see if we can continue here. We're just going to finish this, and then we'll do one more row down here like we did on the other side. All right, so once again, as always, bevel up. And the reason why the bevel up is that the entry point where the bevel, when it's like this, it makes it easier. If the bevel's down, theoretically, it's more intense, little pinch here. All right. Is that one okay?
Yeah, it's almost like right after 3, it just like...
It starts to get sharp. More dull.
There's actually a graphic somewhere that shows like after each poke what your bevel looks like microscopically.
All right. And if you don't mind turning back towards the camera. Okay, perfect. And now we're going to do this bottom row here, kind of where we saw kind of the hair is a little bit more thin. As always, bevel up, guys. And then we'll just prime this because it's a brand new needle. You can see there's liquid there. Okay. And we just got maybe 2 more to do here. As always, bevel up again. Perfect. All right. So hopefully that helps build the PRP for you. Helps you do PRP treatments. And how do you feel?
I feel fine.
Not too bad?
Mm-hmm.
The key is just changing the needle?
I think after a 3rd poke, the needle will change.
All right. Perfect. All right. So now what we're going to do is I'm going to show you how to do kind of, if you have a large area of hair loss, what I do is I switch here to a 27 gauge. This is a 1.5. I like to use a 1 inch. This is a little bit longer than I use. But the same way that you might perform a scalp block, a lot of times what you can use a large amounts of PRP. So for example, Jennifer has great hair, so not so much for her, but just to make her hair thicker, we're going to be doing this. But for a lot of people, you'll notice that they have, especially men, they have the pattern baldness here at the top of the scalp or the apex, right? Anybody who has a lot of traction, alopecia, same kind of deal. What we're going to be doing is we're going to be using an entry point. All right. So little pinch here. And as always, bevel up. We'll prime it too. All right, little pinch here. 1, 2, 3 pinch. Sorry. So now we're through the skin. Now we're just driving. So you can see the needle's all the way deep in there. I'm going to aspirate. 1, 2, 3. We got a negative aspiration. Perfect. And then now we're just going to go to retrograde back out. So we're going to inject while we move the needle back out. And we just go nice and slow. And we want to fill up all of the scalp with this beautiful PRP, which will stimulate growth and increase the thickness and the density of the hair. How are you feeling?
Oh, perfect.
So no, you can see that a lot of it is the technique and the needle sharpness, as we have seen today. So here I'm putting large amounts of PRP, just kind of going back through the scalp. This is great for large areas that have, maybe you see with your camera or even your naked eye, if you have the ability to see some of the follicles that you might see some hair growth starting, but they're not doing that well. This would be really great for that. Really great for some of the most common forms of alopecia, like androgenic alopecia, etc. Doing okay?
Mm-hmm.
Is the pressure okay?
Yeah, like I barely feel anything.
Perfect. That's what we want. And now we're out. And so that took care of, if we feel with our hand here, we have PRP now all throughout this area on the crown, which is great because it's going to stimulate the hair growth in that area. And remember, for even a 0.1 size of PRP, 0.1 ml size, you'll get about a dime distribution. So for such a large distribution, we should have, for such a large injection rather, we'll have a distribution size roughly like this. And so we're going to do the same thing on the other side. And that way, when she has her hair grow, this area will be highly stimulated. And then we'll probably go next to where she normally has the hair extensions. Do you mind pointing to where the hair extensions are?
Yeah, so typically there's one about right there and then one about right here. It's like 2 rows.
So we'll definitely cover the upper one. And then the bottom one, as you can see, even from this, it will actually cover a little bit of that, but we'll probably do one more last one here, kind of where you might start an occipital block. Because, if you feel here on the scalp, I know it's hard to see with the hair, but if you feel on the scalp, here is our occiput. So, all right, so now we're going to do this side. I'm just going to switch sides because it's a little easier. Okay. So I'm feeling here. Here's our last injection. So I can feel our last injection is from here to here. So now I'm going to go from here to here. Okay, bevel up. Little pinch here. Sorry about that. And you can see drive all the way deep down there. Going to go ahead and aspirate for 3 seconds. 1001, 1002, 1003. Perfect. We got negative aspiration. And now we're just going to slowly inject as we retrograde back, meaning we pull the needle back at a very slow rate while we're injecting. And just for the camera, we see here, we see our injection as we go backwards. I'm going to save the left half cc for the bottom of the hair. Doing okay?
Mm-hmm.
Perfect. All right, and there it is. So now we have 2 beautiful large insertions of PRP, which should diffuse to pretty much this entire area. We do know in the past there were hair extensions that attached here, kind of more near the occiput, so we'll just do a quick row here, and we'll do that kind of almost like a horizontal injection. So I'm just going to try to find a good entry point. And I always like to feel the anatomy again. So if I feel that, here's our occiput, perfect. I'm just going to lift this hair up here. Our goal is to do an injection like about there. Little pinch, sorry about that. So just go through the dermis and then just drive through. Ta-da! And so you can see here, aspirate, negative aspiration, perfect. We got about a little less than half cc. We'll just inject as we retrograde out. All right, guys. So basically, we've done our PRP injections, and now Jennifer's going to show you how to do a scalp massage. There's kind of 2 different ways to do this. One of the ways that Jennifer's going to show you here is basically how to stimulate the lymphatics. Now that we've put in basically the PRP, which is going to have the cytokines and growth factors that stimulate recruitment and regenesis of the cells in the area, we need to make sure that we have good lymphatic drainage because the lymphatic system, of course, provides many of these cells to the area.
Okay, so I recently took an osteopathic class, and one thing we learned was scalp massage. One, it feels very good to the patient, but I feel like it moves the product around. So again, just like the thought is, it's kind of like you put your hands here and almost like you'll firmly plant your hands on their scalp. And then it's just like a small back and forward motion. And if you try it on yourself, you can feel it. It feels really good. But just think of like sliding skin. You do that kind of in all the quadrants, like 4 quadrants of the head. Just kind of slide the skin back and forth over the scalp. And then just make like small circles again where you're sliding the scalp. Just all around the hairline. And you can do this even without PRP hair injections. So say like if you are just wanting to stimulate your scalp, just do like small circles where you're sliding the skin. and then come back here to the center and just like small circles where you're sliding the skin. It feels so good, especially if you have someone else that can do it for you, or you can just do it on yourself. I think it's really good just like for health of the scalp, just to like regularly massage your scalp out. So hopefully that helps, especially if you give facials in your office. If you can do a scalp massage at the end, it's very nice for the patient. And then even one of the things they showed us is just kind of take all the hair and just gently kind of like pull, just to give a little like movement in the scalp. That's kind of like a ponytail, and then just move further down the ponytail and just kind of pull, and that just stimulates the scalp, and it feels so good. So hopefully you enjoy that, and so you can do it on yourself too.
All right, excellent. And so anything that you can do to stimulate more blood flow to the scalp will always improve your results. And of course, it sounds like, how do you feel after doing that?
It feels good. It's good.
So it also very good for patient satisfaction as well.